Jeff Mayno and Nicola Twilley have been researching quarantine since long before the COVID-19 pandemic, and they make the case that disease and quarantines have, in fact, shaped much of the modern world, from international borders to passports, travel, and agriculture.
Their book is called Until Proven Safe: The History and Future of Quarantine. Jeff and Nicola join us live now. Good morning.
Good morning.
Good morning. Thanks for having us.
Thanks for being here. So first, when you look historically, I felt like, during the pandemic, people kind of felt like this was a novel idea, but clearly throughout history, we've seen issues like this, including Black Death. When you look at past pandemics and quarantines and compare it to what we've just gone through, where are the areas still of improvement? Are the mistakes being repeated throughout history?
Yeah, that's a great point. And one of the things we learned by writing this book is that we have made the same mistakes again and again. And it's about time we learned from experience and improved quarantine next time. One of the biggest ones is just not thinking about quarantine as a lived reality. Public health officials think of it as this tool they have to, keep a disease under control, reduce spread, all the things they need to do to prevent the healthcare system from getting overwhelmed. But actually, people have to live through it. They have to eat and pay their bills and just be people connected to other people. And that is what's missing in how we think about quarantine.
It seems like, I can't tell if it was 2 weeks or it feels like 10 years ago when we were all in quarantine in March of 2020. It was a terrifying time. Jeff, what were some of the big mistakes that you think were made? Looking back, we have 2 years now of reflection. What are some of the big takeaways of what we went through in that time?
Yeah, I think that communication is a really big problem in terms of making sure it's clear why we're even doing this. When people are asked to go into lockdown and quarantine and not see family members, not see friends, to maybe stop even going to school. I think that there has to be better communication from the government and also from public health authorities about what it is that we're facing. What are the risks? Why are we? What benefit does this do for the hospital system, for nurses and frontline workers and that kind of thing? I think those kinds of questions need to be better addressed and better communicated to people. And I think that that's another thing that when you look at the history of quarantines, you really see the same kind of problems, from centuries in the past. Where inadequate information is given to people and they just simply don't understand the stakes or the danger or even why they're doing something. I think that one of the things that came up a lot was that, we're doing quarantine because it's kind of a sacrifice for the greater good. But even that wasn't very well communicated. So it just sort of felt like, an incredible amount of responsibility was being dumped onto the everyday individual. Yeah. And that, we had to take on things and just sit in our houses. And it wasn't really explained to us that we're doing this for everyone, for the greater good. And those kinds of questions, I think, will need to be better addressed if there's another quarantine to come.
I think particularly this generation is going to look at quarantine and think about it in the medical sphere. But quarantine, if you've gone to Hawaii or some island, you know that they quarantine plants or they quarantine animals. Just in terms of the history of quarantine, do you think that people have a good handle on what that actually means and why we do it?
Yeah, quarantine, as you say, sort of affects everything from planetary exploration to agriculture. And it's really one of the main tools that we have in a situation where we don't have all the answers to just buy us some time and keep things safe. It's a sort of a buffer zone, if you will. And people only think about it as, hey, it's not helped by the fact that, public figures even misuse it. If you already know you have a disease, you're not going into quarantine. The entire point of quarantine is this uncertainty, this need to buy time to figure out what's going on. And I think if people had an understanding of what quarantine is and isn't as a tool, how it can work, how it can't work, what it's done to keep us safe, and why it fails when it does fail. Those are the kinds of things that could enable us to use what is a very powerful tool, but also a very costly tool, much better in the future. And so as we kind of wrote this book and explored quarantine in all of these dimensions, from, the California border to nuclear waste to NASA's, Mars rover, we really kind of teased out what it is about quarantine that works and why it doesn't work when it doesn't work.
So in your book, God forbid we go through another pandemic in our lifetimes. Hopefully we do not, but do you address how quarantine would look in the event of another pandemic?
We do, and you know, unfortunately, as with all you know, current events, you know, there's good news and bad news. But I think that the good news is that, you know, by having just gone through 2 years of COVID and you know, seeing what works, what doesn't work, which includes even just you know, how people's homes are laid out, or maybe how hotel rooms are designed, or how we get people into quarantine facilities. You know, I do think an awful lot of advances have been made in terms of thinking through how to make it easier to quarantine at home if we have to do that. How to avoid things like school shutdowns, which may not necessarily even have been the right step to take in terms of a disease like COVID-19. You know, how to maybe use public facilities so that we can actually flip them much easier into a temporary quarantine facility. The bad news, I guess I could say, is that, you know, there's also other visions of quarantine to come that I think are a little scarier, that involve you know, big tech companies that have access to our health records, or to even the locks on the front doors of our homes, that can make potentially some very dystopian decisions in the future.
Wow.
You know, where we've outsourced a lot of this stuff to you know, some, you know, very large big data companies who are going to keep track of maybe last time we've been to a doctor, or whether or not we're vaccinated. You know, there's some really important questions that I think we need to address now that we've seen what COVID, you know, something is like COVID was capable of doing to our society, and what might come down the pike later. So I think that now is the time, and it's one of the reasons why I think you know, it as much as we all want to get past COVID-19 and quarantine and never think about it again, it's an incredibly good time to stop and pause and think, you know, what worked, what didn't work, and what are we going to do next time. You know, now really is the time to reflect and to plan ahead and to make sure that we get it right next time.
Points. For more, check out untilprovensafe.com and follow Jeff and Nicola on social media. Thank you both so much for joining us this morning.
Thank you.
Thanks.
Thank you.